Hello everyone. In this particular case, I want to demonstrate how I managed a case of bullous DMD in an 86 years old male who was referred to me for corneal edema management 2 days after cataract surgery. So you can see in this ASOCT picture which shows shallow AC along with bullous descent membrane detachment. So I decided to take the patient for air injection. I began by debriding the epithelium to get better visualization of AC. With 30 gauge needle, I injected full chamber air, and the AC was well pressurized. Immediate post-op examination on slit lamp shows full chamber air along with some Descemet folds. ASOCT looks good, which shows attached DM. 1 week post-op, patient complained of severe photophobia, blurring of vision. When the ASOCT was done, it shows detached Descemet membrane. At this point, I did some literature research and I came across this study where DMD was managed using Suture Descematopexy. We can make out from the picture that total DMD after SICS was managed by placing mid-peripheral sutures, but in our case, the DMD was central. So I decided to place sutures more centrally, sparing the visual excess. I began by debriding the epithelium so that I could visualize the anterior chamber clearly. I placed an X stitch over the main phaco wound because the AC was also shallow and I wanted to secure the wound. As I mentioned previously that our DMD was more central and it was bullous. So I decided to place sutures more centrally in a triangular fashion. All these sutures were taken full thickness. So the first suture was placed inferiorly, the second suture supero-nasally, and the third suture supero-temporally. Isoexpensyl C3F8 gas was injected intracamerally and a full chamber gas fill was achieved with a good pressurized anterior chamber. Immediate postoperative examination on slit lamp showed around 80% gas fill with intact sutures. 2 days post-op showed around 40% gas fill with intact Descemet membrane on ASOCT. After 3 weeks, I removed the sutures. The DM was attached. The vision improved to 6 by 60. After 6 weeks, the vision improved to 6 by 18.